Good afternoon, everyone. This is County Executive Pat Ryan. Thank you for joining us for our COVID update. Today we'll talk about the ongoing situation with COVID pandemic in Ulster County and add some more detail and information about our vaccination plans and really resources for you all in our community who I know have many concerns and questions. And our goal here, as always, is to lead with the data and the facts and the advice of our health experts and share as much as we possibly know with all of you so that we can just get through this challenging pandemic together, get out the other side, and have a brighter and a healthier 2021. Before we start, I just want to recognize that obviously in the last 24 hours in our country, it's been a very difficult and a very dark 24 or 36-hour period here. I feel strongly that what happened yesterday was a brazen insurrection, that it is an affront to our democracy, and that it's incumbent on all of us to call that out as such and to condemn that, which I strongly do. I don't think it bears dwelling on here, but I do think it's important to say that clearly and for us to all, as Americans, make a common stand for the principles and the values articulated in our Declaration of Independence and our Constitution, and when those lines are crossed, to say so. So, moving on from that to the COVID situation, we are still very, very much in the midst of the second wave, and unfortunately continuing to see the very tragic human toll of what's happening in Ulster County with the pandemic, both with those that are sick, hospitalized, and unfortunately succumbing and passing away from the virus. Looking at our total numbers cumulatively, we are approaching 7,000 total cumulative cases. We're at 6,890. We've administered now 205,000 plus tests and continuing to ramp that up. Thankfully, I've had 4,864 recover. Unfortunately, today, our number of reported fatalities is up significantly. If you remember in our last update, we were at 144 and we're now at 162. There's two things happening to lead to the fact that we've had 18 additional fatalities in the last since the last update. 4 of those occurred in the last 48 hours, and the remaining 14, we had basically a reporting lag from some of our facilities in the county that were slow in reporting that data to us. For that, I apologize, and we are working with them to make sure that that does not happen again. So those fatalities, those 14 additional, happened over the last several weeks, but because of some confusion about reporting to the county health department, we had not been informed of those until yesterday. So I wanted to make sure to clear that up. But that number of 162 fatalities, again, is very hard to stomach and very hard to share. Those have all occurred in the last month period, meaning that in about the last 4 or 5 weeks, we've had well over 50 and approaching 60 fatalities from COVID just in the last month. A very sad reminder of how deadly this virus can be if we don't all take it seriously. In terms of the hospitalizations, some relatively good news here in that we're holding steady. We're at the same number of hospitalized as we were on Tuesday. We're at 32 hospitalized, 3 in the ICU. That is still quite high and very much harkens back to where we were in April and May, but it's at least somewhat stabilized over the last 48 to 72 hour period, and of course now we want to start bringing that down. Probably the most encouraging news to share today is our active case count has dropped significantly as we've now seen more recoveries from COVID in the last week or so. So we're down now to 1864. We had been over 23 and approaching 2,400 last week. The one caveat here, though, to be clear, is that we still think we're not seeing the full effects by any means of holiday gatherings, Christmas, and especially New Year's gatherings. Those really aren't showing yet in this data, so there is some chance in a worst case scenario that this could pick back up. But it would be awfully good news if this were the beginning of the downslope back from the second wave, which would then lead us into the vaccination process that we're now starting to ramp up. In terms of the new positive rate, in the last 48 hours, we have tested 3,300 residents and had 261 positive of the 3,300, putting us at a 7.9% new infection rate. That is slightly down. We were closer to 10% new infection rate at our last update 48 hours ago. Generally, we've been hovering the last few weeks somewhere between 7 to 10%. That is not a good number. That is not a sustainable number. We have to get that back down to obviously 0 as the ideal, but even to be able to hold at between 1 and 2% like we did in the summer is a manageable level. We are obviously not at that yet, and very much do still believe we are in a community spread type of dynamic with COVID-19 in Ulster County. The long-term cumulative projections you can see here, and again, this is a reminder that decisions we're each making on an individual basis will affect the total number of cumulative cases. You can see, for example, looking 2 weeks out, we could have 8,000 cumulative or we could have 10,000 cumulative. And of those total cases, we know that the more that have it will be hospitalized, the more that are hospitalized will die. And so the decisions of each of us directly affect those that we might lose in our own community. And so please continue to recognize that and think about that. I know it's been exhausting to deal with the restrictions and all the precautions, but it's necessary, or else we wouldn't be asking everyone to do it. In terms of our hospital capacity looking forward, we're in the same situation we were in our last update 48 hours ago. We are at 32 hospitalized, 3 in the ICU. We are very closely monitoring the capacity threshold. We did on Tuesday report that we were at risk of falling below that 30% capacity, which could trigger some restrictions from the state. So that is something that we're watching closely and working to address. Once again, that all ties back to each of our individual decisions about what we're doing to maintain those precautions. So that is a great segue to, once again, as always, remind each of us and ask us to remind our friends and colleagues to wear masks, to maintain social distancing both in public and also to maintain it in gatherings, and to avoid social gatherings and get-togethers with those who you don't know who they've been interacting with, and of course continue to wash hands and use hand sanitizer. The other thing that I wanted to update you all on, we announced some significant details and additional information about our vaccination plan here in Ulster County on Tuesday. I continue to feel good about our ability to rapidly scale up and basically as many vaccines as we can get from the federal and state government. We are ready to get those out. We'll have, I'll talk about all the details in a moment of how that is going to work. But before I do that, I know that the vaccination process, both the science behind the development of the vaccine and also the logistics of how it will be distributed, who will get it when, where they should go, how we sign up, I know that is of great concern to many and that there are a lot of questions. As we've done throughout the pandemic, I believe that the only way to address that, of course, is by sharing information with you all, empowering every resident with knowledge, and with that knowledge we can build trust and confidence in the whole process that we have, both in the vaccine itself and in our ability to distribute it. So with that in mind, today we're actually launching our Ulster County Vaccine Resource Center. This is a web portal that's part of our COVID-19 dashboard and page, but it's specifically designed with you all in mind, with all of our residents in mind. and I'll talk about those functions in a minute, but that URL for that is at the bottom. And there are really three main things that you can do on the Vaccination Resource Center. Number one, and probably of most interest to most folks, when you go to the site, it'll look like this, and you can click on that first box on the left, and what that does is actually signs you up on a list. We'll get some basic information from you about your health and your location, and that signs you up to receive more information about when you specifically, based on your situation, where you live, where you work, what your health risks are, what your age is. That will allow us to communicate with you directly about when you are eligible for the vaccine, and then also give you follow-on instructions for how to sign up and get an appointment. So when you go to the page, you'll sign up for this list, and what you're basically doing is saying, hey, when it's available to me, which I know might not be immediately, but when it's available to me, I want to be informed about that, and I want to get those instructions about where and how to sign up and so on and so forth. So if you are out there and wondering when you'll be eligible, and just in general wanting more information about how this will work here in Ulster County, I ask you to go to that webpage and sign up using that button that says Vaccine Notification Request. The other things that you can do on the page are just get broader information about the process. So in the middle there, you'll see check your eligibility. There are a lot of questions, understandably, about which phase and category everyone is in. I'll talk more in a minute about phase 1 here shortly, but if you want to click that link, that'll give you all the detailed information directly from New York State, and they're the ones that are setting these categories and criteria. That'll allow you to check when you're eligible, and based on what category you fit in. And finally, the third thing you can do here, and we'll be building this page every day, day by day, but we already have about 15 frequently asked questions up on the page. Some of them are health-related questions, some of them are logistical questions. These are questions we're already commonly getting, but as we get more of them, we'll add them up there and we'll answer them with our experts, whether that's our health commissioner or the chair of our Vaccine Distribution Coalition, Dr. Tack, or whoever makes sense to expertly answer your questions about how this is going to work. And if you have questions that aren't on the FAQ now, of course you can let us know that as well. So this is a really great resource to empower all of us with more knowledge, not just of what's going on nationally or at the state level, but specific to Ulster County and to each of us. We thought it was important to have this for each of you. So please go there and check that out and sign up if you want more information there. In addition, I'm going to quickly just go over again. I shared much of this on Tuesday, but for those that weren't able to see that, I want to reiterate just how this is working in terms of vaccine distribution here in Ulster County. So I'll put up this graph again, which shows you all the moving pieces of our vaccine distribution plan. Most important to recognize is that our vaccine operations in the middle there really are a hub, and there are a bunch of spokes coming out of that hub. Those are really all the different ways and places and partners that we'll bring to bear to get the vaccine out to all of you. That'll include 2 point of distribution sites that our county will lead and run, as well as a bunch of other places over time in the next few weeks and months that will come online where you will also potentially be able to go to get vaccinated. That might be your local pharmacy, your private doctor or doctor's practice, an urgent care center, a federally qualified health center, and so on and so forth. So as we have more resources coming online, I'll update you all there as well as we bring more sites on. Each of those needs to be approved by the State Department of Health. So as those get approved, we'll communicate that with each of you. Right now, the 2 sites approved, in addition to the hospital, the Health Alliance, is our county-led sites in Kingston and Ellenville, and I'll talk about those here now. The one in Kingston will open just for people that are eligible. It will open for eligible recipients of the vaccine on Monday, the 11th. It will run 7 days a week, and we will run that thing until we get everybody vaccinated. The other one will be our secondary site at Ellenville Regional Hospital, and I want to again thank the great team there, Steve Kelly and Ashma Butler and the whole team for helping us plan that. Once again, very important caveat here. All of these sites are going to operate by appointment only so that we don't have long lines that might put people at health risk, and so that we can have some order to the process and keep everybody safe. And all of those appointments are guided by the New York State vaccine prioritization guidelines, which I'll talk more about here in a minute. This is just a schematic of the plan for the Kingston High School site, really more to just show this is one of about 100 pages of our in-depth plan for how these will run, but to make everyone comfortable and reassure that we've put a great amount of thought and detail into these plans. And I do also want to take this opportunity once again to thank Dr. Padalino, the Kingston School Superintendent, as well as the school board and all the leaders of the Kingston School District for agreeing to offer up your newly renovated field house once again to the county to make sure that we can be there for our community at this critical moment. Those are the kind of things that give me hope and optimism about our community coming together to meet this challenge and unify. So thank you to you guys for that. Here's some photos from that site. It's being built out right now as we speak. It's probably even more built out than these photos show because these are from this morning. So our crews are working around the clock, and I want to thank them for that. We're going to be staffing this with our own county staff as well as a host of volunteer medical professionals and others that have already stepped up to help. So we thank you all for that and for the work that we're about to do there. When all these sites are online and running at full capacity, and when we have enough vaccine doses flowing to us, the capacity for these sites between the two county-led POD sites will be 50,000 vaccines a month. That will let us pretty quickly get through 2 doses each to a large number of our 180,000 residents. And then when you add in, of course, our other partners that'll come online, that puts us in a very good position to rapidly and safely and equitably get this out to everybody. The next 2 slides, I'm just going to talk about, and these are the majority of calls and questions that we're getting right now, understandably, who qualifies for the vaccine now, and then also who's sort of in the on-deck circle, to use a bad analogy, who's going to be next in phase 1B. So right now, here's a long list of individuals and groups that are in phase 1A, which is what we're in right now across New York State. Essentially, these are healthcare workers working in a whole bunch of different ways, but essentially healthcare workers that are most exposed to the public that might have, that either definitely or might have COVID. So that includes everything from, of course, our ER workers and ICU staff, to EMS, to medical examiners, staff in our senior facilities and our group homes, urgent care providers, anyone that's going to administer the vaccines. Of course, we're giving them the vaccine first. And really all frontline high-risk public health workers who have direct contact with patients or are testing people for COVID. So this is, in New York State, all told, this is about 2 million people in the state fit this category, which is about 10% of the whole population of the state. So a pretty significant number. So in Ulster County, we're talking about thousands of people that fall into this 1A category. So we are still working our way through getting doses to them. We have not gotten nearly enough vaccines yet to get everyone in 1A vaccinated, but we believe starting next week and in the coming weeks, we should be able to do that. And our hope is by the end of the month at the latest, we can get through 1A. Hopefully we can do it sooner. And then we would move into 1B. And 1B is again, a very broad category, which is good news. A lot more people will now qualify in the county under 1B. To be clear, we are not in 1B yet, but This is sort of a heads up that as directed by the state and by the governor, these are the groups of people that will be eligible in 1B. So in particular, if you're in 1B, if you're a teacher, first responder, public safety worker, transit worker, or anyone over the age of 75, if you're in that 1B category, I'd especially encourage you all to go to our vaccine sign up to make sure that we have your information so that we can be proactively letting you know when you're eligible. If phase 1B works the way that 1A has, what will probably happen is even within this broad group, this big list of 1B, there might even be some sequencing of those. I don't know what that will be yet, but for example, we might have first responders before we have those over 75. I don't know yet what the state will direct there. Point being, we will be able to tell you specifically where you fall there so that you can then get signed up. So please, again, do go to that page and sign up. Finally, as we continue to work our vaccine distribution efforts, we are doing this as a community-driven effort. Our vaccine distribution coalition is continuing to grow and build every day as we bring on more members, leaders, and trusted voices from across our community from many different perspectives who are going to be able to help us get this out safely, to build trust and confidence in the vaccine, and to build trust and confidence in our processes to distribute it equitably. So that group is continuing to meet, and I want to thank every member of that as well. Finally, I know that was a lot to throw at you, but I want to just make sure that throughout this, particularly as we ramp up the vaccination effort, that we're sort of over-communicating. And if you do have questions, of course, let us know. I want to thank all of our frontline workers. I want to thank especially those that are about to step up here. We've got a group of 100+ staff, from health nurses to administrative workers and others, many of whom are volunteers that are signed up, and tomorrow will actually get trained at one of our 2 facilities, our point of distribution sites. They will get trained to start bringing our county-led sites online on Monday. So I especially want to thank all those individuals. We're going to be asking a lot of you to work 7 days a week through this, but it is truly impactful and noble service. And so thank you to you. Thank you to everyone that's been doing that throughout this. I can't wait until I can announce more and more people eligible for the vaccine, and until I can announce that we're getting higher numbers of doses coming to us from the federal government. I'm optimistic that that's coming, but I will continue to push like heck to make sure that we get that as quickly as possible and that we get it right here in Ulster County. Please know that. Finally, if you have any questions about what's going on with COVID, if you're having trouble accessing the vaccine website that I announced, you can also call our Recovery Service Center at 845-443-8888. I imagine we might get a lot of calls in the next few hours. Normally, we're pretty quick at getting back. If we're getting a high call volume, please be patient there. And again, you can go to our website for the Recovery Service Center, which is on the screen, and also at the Recovery Service Center. Not only can we help with testing and vaccination, but also with any other needs that you might have for you and your family and your loved ones, from food to shelter to other critical essential services. So don't hesitate to reach out. Again, I want to thank each of you for tuning in and helping spread this word as well. Please share this information. We'll put up a graphic on social media with our Vaccine Resource Center. Please share that widely. We want to really make sure people know what is going on in the county with this. I believe that this is the single most important work and effort that we will undertake in our entire pandemic response is getting this right with the vaccination effort. And that will involve everybody being bought in and informed and having that trust and confidence. So please share the information. Our next regularly scheduled update will be next Tuesday at 3 p.m. Remember, we move these back to 3 p.m. And until then, please stay safe and healthy. Let's stay resilient as a community, especially during these rocky and difficult times for our country. And I am still very much optimistic about 2021 and about our community coming through this better and taking care of each other. So thank you, and we'll see you Tuesday.